Hi, everybody. I'm Jocelyn Momenta coming to you from Hartford Healthcare St. Vincent's Medical Center studio in Bridgeport. Are you considering surgery after losing weight? Are you a cancer survivor who wants to know more about breast reconstructive options? Joining us today is plastic surgeon Dr. Elizabeth Stirling Craig with Hartford Healthcare St. Vincent's Medical Center to talk about cosmetic and reconstructive surgery. Dr. Craig is board certified in both plastic and reconstructive surgery. Dr. Craig, is cosmetic surgery booming right now?
It absolutely is. I think that a lot of people had put things on hold because of COVID. I think the stress of COVID changed people's patterns in terms of taking care of themselves. And now that a lot of people are able to work remotely, the recovery time is much more amenable. They don't have to take off time off of work. So plastic surgery, cosmetic surgery is definitely on the rise.
So you're saying basically the increase was due to a backlog of people from the pandemic, but is it also because people are wanting more procedures now?
I think so. I think part of the virtual Zoom meetings brings attention a little bit more to the face, maybe aspects of it that we didn't really appreciate before, and it's kind of a new cosmetic pressure.
Okay, I've heard that Zoom meetings led to more people coming in to see what the options are for cosmetic surgery. I thought that was a myth. So
No, absolutely.
That's a real thing?
Mm-hmm. And the reason I feel like it is a new pressure is that you're seeing more men involved, more older women interested in finding new sort of non-invasive ways maybe to improve their youthful appearance.
What are the most requested areas for cosmetic surgery?
Right now, I think the number one is probably liposuction. I think the COVID-15 is real, and we didn't all necessarily take that great care of ourselves during that stressful time period. Next to that, I think a lot of patients, again, are re-looking at themselves in virtual meetings, and the face is probably the number two.
Liposuction. Take us through what that all entails.
So I know that liposuction can be sort of daunting. It's definitely not something that I think that you want to be awake for, but it's simply just removing the fat from areas where we, especially women, have genetic deposition of fat. So areas that no matter what you do in terms of diet and exercise, your body will still hold on to. So liposuction is a great tool that allows us to remove those areas of fat.
So basically you have a tool that goes in and sucks the fat out.
Exactly. So it's just a poke hole incision, so just a little poke hole of a needle, and then we have a tool that sucks that fat out.
I've been in the OR and actually doing a story on that. That's incredible. It really is.
Yes.
All right. The facial procedures, what are people looking for when they come to see you? I presume Botox?
Of course. I think Botox and fillers are the number one non-invasive tool that we have to rejuvenate the face. And probably second to that, a lot of people are looking for upper eyelid lifts, especially with all the virtual and Zoom meetings. Eye-to-eye contact means even more, and people don't want a tired appearance. So it's a great short procedure with a very short recovery time, and it's definitely on the rise.
I hear a lot about mommy makeovers. What is that about?
So a mommy makeover just refers to all the changes that our bodies go into as a result of being pregnant. So oftentimes the breasts will be droopy after either breastfeeding or even just delivering a baby. And then you gain weight when you're pregnant, and sometimes it's very difficult to lose that weight. So a mommy makeover usually refers to getting rid of that extra abdominal weight, usually with a tummy tuck or liposuction, and then rejuvenating the breast, and that's usually with some type of a lift or an augmentation if the patients are looking for a fuller look.
Is there anything that can be done for stretch marks?
Stretch marks in general are removed for the most part when we do a tummy tuck, because most of those stretch marks lie in and around the belly button and kind of the lower aspect, because that's where all the baby weight is putting pressure on the skin. So a tummy tuck, for the most part, gets rid of those.
A lot of women actually do like seeing their stretch marks. They look at it as a what?
Positive reminder.
Positive reminder,
Yes.
exactly.
Yes, I would agree.
Okay. It's not just women. You mentioned it. a few minutes ago, men are also coming in for cosmetic procedures. And why is that? Why are we seeing more men coming in?
Again, I think it's the virtual meetings. I think there is a cosmetic pressure around professional men appearing, not as tired and maybe as aged as sometimes the camera can add. So we're seeing a lot more Botox and fillers in men, surprisingly, and then facelifts as well.
Any of them asking for a liposuction?
Some, not as much probably as the women.
So they take more of the less invasive procedure.
So far.
Is there such a thing as a daddy package?
Of course.
There is.
I think a daddy package refers to the weight that dads gain as a result of all of the pressures of having a new baby, and most of that is usually just liposuction.
So they don't go for a tummy tuck or a pectoral implant?
I think pectoral implants are less popular nowadays, but the liposuction of the chest, again, is very popular. So usually the men will have relatively large muscles. It's just that maybe we can't see them because they're being hidden by all the fat. So if we take away the fat with liposuction, then you can finally see the sculpted muscles that they have below.
What are the latest breast reconstructive options for cancer patients?
So cancer patients really have a whole slew of options now. We can do anything from what we call alloplastic, or using a combination of expanders and implants, which probably majority of people are somewhat familiar with, and then using your own tissue, which is what we call autologous tissue. And that's where we transplant fat from another area of our body to the area of the breast where the breast was removed.
We're going to go through the different implants, pros and cons later on in this conversation. But right now, can you explain the different type of flaps, which is what you just referred to,
So flap just refers to tissue in our field. And we get them in different parts of our body that are supplied by a very specific artery and vein. So the lower abdomen, kind of the pooch where a lot of women carry extra fat, is what we call a deep flap, and that's probably the most common flap that we do for breast cancer. Probably the second most common would be what we call an S-gap flap, and that's a buttock flap if patients tend to carry their weight in the buttock area and maybe less in the abdomen, we'll go there. There's just endless amounts of flaps.
So you're transferring whatever's here or whatever, what's behind you, to where? Where are you putting it?
Wherever we need it. So for breast cancer, usually we'll transfer the tissue from the buttock to the breast, or from the lower abdomen to the breast.
Wow. I hear a lot about prophylactic treatments for breast cancer. What is a prophylactic procedure, and how does the patient benefit?
So prophylactic just means that the patients are taking an initiative on their overall health care. Maybe they have a strong family history of either breast cancer or ovarian cancer, or have had multiple biopsies, and they're choosing to reduce their future risk of breast cancer.
Or somebody who may have tested positive for BRCA1 or 2.
Exactly.
That's the gene for breast cancer.
Exactly. So they're just electing to undergo a mastectomy even though they don't have cancer. They're trying to stay ahead of it.
Well, are these patients candidates for immediate reconstruction?
Absolutely. Nowadays, probably 90 or more %, at least in our practice, undergo immediate reconstruction. And that can be in the form of an expander, an implant, or using your own tissue.
I'm glad you mentioned an expander. What is a tissue expander?
A tissue expander is just a saline-filled bag that we put inside the breast at the time of the mastectomy to hold the skin open. And eventually we transfer that out and put in a permanent implant. So that's what we call two-stage reconstruction.
What are the stages when we're talking about permanently implanting something?
So direct to implant would be what we call to single stage reconstruction, where we're able to put in an implant at the time of a mastectomy. And the two-stage reconstruction, either because the cancer required removing a lot of skin, or the skin itself doesn't look quite healthy and can't accommodate a permanent implant, we have to put in somewhat of a deflated tissue expander to preserve that skin until it's healthy enough, and then we switch it out to a permanent implant.
Let's take a look at what you have brought here. And what are we looking at here?
So this is an array of silicone implants, and this is just to show that there's different what we call cohesivity. So implants have come really far, in particular the past 10 years. It used to be that we just had this one here at the bottom, which is called soft touch. Now there's 3 different sort of consistencies, if you will. So we have this display so that patients can feel it. They all look the same because they're all the same volume, but they feel different. One is firmer than the other.
Okay, this is the softest.
That's the softest, exactly.
It is pretty soft.
Yes.
And then this is a little
That's
firmer.
the medium.
Okay, just a little bit.
A little bit more.
This will probably be a big difference. Oh yes.
It's a little bit more firm.
Yes. And how do you decide which one?
Which one to use? So most of the soft touch implants are for augmentation because patients have a lot of overlying breast tissue to conceal the implant, and you want something that feels natural. So implant rippling, as you see, is not as visible because there's breast tissue concealing it. So you can use a soft touch and an augmentation. But if you use this one, for example, in a mastectomy where they have no overlying breast tissue, then you can see more of the implant rippling, which is unsightly for patients. So this one that has less rippling, as you can see, is more of an implant that we would use in a reconstructive patient. It tends to be slightly firmer. It's not too firm, but it has less wrinkling and rippling, so it's not as visible in a reconstructed patient.
And this one, the middle one, is for somebody who
Kind of the
is in between.
Yeah.
Kind of
For
deciding
patients,
as to
for
which
example,
one.
if they're looking for a lot of projection and maybe their skin doesn't seem to accommodate that, we need something a little bit firmer to push that skin out.
Wow, a lot of information there. Thank you very much. We do have some viewer questions.
Okay.
Will you take some of them right now?
Absolutely.
Here's the first one. I'm considering a number of cosmetic surgery options for my face. Can I get a couple procedures done at once?
Absolutely. So it's not uncommon to do multiple cosmetic procedures at the same time and or in combination with another type of surgery. For example, patients will have a hysterectomy, and at that time we will follow the OB-GYN and perform a tummy tuck. Okay. So combination cases are pretty routine.
Here's our second one. What are some of the less invasive cosmetic procedures? We touched upon that a few minutes ago.
Yeah, I mean, I think Botox and fillers are the start. I think nowadays a lot of people are doing what we call fat grafting. So instead of using a filler, you can utilize your own fat to fill portions of our body where maybe we're deficient. A good example of that is what we call the Brazilian butt lift, where we take fat maybe from the abdomen where patients have too much of it, and we inject it in the buttock area where they would like more projection or more volume.
Does my weight affect my outcome if I want cosmetic surgery? Should I lose the weight first?
It depends. So if you lose the weight in the area where you would like to have surgery, then probably it makes sense for you to be at a weight that is stable. Because if you lose weight, you'll probably have loss of volume and some extra skin, and you don't want to have a revision. But not everybody loses weight in the exact same areas. You know, some people lose weight in their lower third. Some patients lose more weight in their face and in their chest. So it kind of depends on where you specifically tend to lose and gain weight.
Oh, that makes sense. The next question is, I'm looking into a flap procedure. I am a smoker. Will that affect my recovery?
So smoking is not a direct contraindication to flap surgery. It just means you're at higher risk for wound healing. So it doesn't necessarily mean that the transplant won't be successful. It just means that the areas where we took the tissue from, meaning your incisions, they have a harder time healing because the smoking decreases the blood flow to those areas. And in order to heal, we need blood flow.
Are you accepting new patients?
Of course.
Oh, that's good to hear. Dr. Craig, thank you. And for more information, go to stvincents.org/breast health. Thank you, everybody, for watching.
Thank you.